Okay, so talking about all those fetal tests, right, that are done for babies that are still in the stomach, just to dictate disease conditions. The next one we should be looking at is what is known as what? Amniocentesis. Amniocentesis. Now, I want to describe something for you people before we begin. In amniocentesis, I'm actually putting what? A needle. So I'm putting a needle through the stomach of the pregnant mother, right into the what? Amniotic fluid. Now, putting this needle will be painful. So yes, of course I have to use anesthesia. I'll numb this place so that she doesn't feel the pain. Now, also putting this needle to around this baby's place would be risky. So I have to now use what? An ultrasound. This is a transducer. Okay, the ultrasound screen is that side. So I'm using this transducer to put on the stomach of the mother so that I'm seeing it on the screen, so that when I put the needle, I'll be guided, so that I don't injure any other structure within the stomach and I don't injure the baby. Do you understand? So this is just what is involved in amniocentesis, so that when we start, you guys will still understand. Not that you see, how can it be putting injection in my stomach? No. It will not get to hurt anything. All right. So it's a prenatal diagnostic. Prenatal meaning they are doing it before you give birth to the baby. So it's used to dictate if there's genetic issues, if there's chromatic issues, if the baby has infections, or if there's any other thing wrong with the health of your baby. Okay. So it involves extracting a small amount of the amniotic fluid. Amniotic fluid is this blue fluid here. This is where your baby is swimming, all right, before you give birth to them. So of course, if there's something wrong with the baby, I should be able to pick it from the environment. Do you understand the basis? All right. So the protective liquid surrounding the baby in the fetus is the amniotic fluid. So why is it done? You can be doing it because it's a prenatal test that shows a risk of chromosomal conditions like maybe Down syndrome. Don't worry about that. Okay. You might be doing it if there's a family history of genetic disorders. Do you understand? So you have asked the mother, and she has gotten to tell you that in their family, they usually have these issues. If the mother is 35 years or older, so women that are going towards menopause, there's a higher risk of them giving birth to babies that are defects. That's why we say women should marry 25, 26. By 31, 32, you are done giving birth. You now enjoy your life. Okay. So if ultrasound reveals abnormalities, if there's a need to access fetal lung maturity, if there's a concern about fetal infection or rhesus incompatibility, if there's too much amniotic fluid, that's what polyhydramnios, and some needs to be removed just to relieve or analyze, So what it can dictate? It can dictate a lot of issues. In fact, these ones were just listing little ones. If you meet a doctor, they will give you a list of things that this amniocentesis can help to dictate. So chromosomal issues like Down syndrome, Edwards syndrome, Fetal syndrome. If there's anybody who wants to learn about any of these diseases, just comment. All right, I'll teach you. Cystic issues like what? Cystic fibrosis, Tay-Sachs, right? Sickle cell diseases, muscular dystrophies, neural tube defects like spinal bifida and anencephaly, fetal infections or anemia, all right, fetal lung development issues, all right. So the procedure is performed between week 15 or week 20, all right. If it is not within this time, it will be hard. Okay. A thin needle is what inserted through the abdomen, right? And you're using ultrasound to guide you. See, I'm looking at the stomach here, so I can't injure anything. Do you understand? It's inserted into the uterus using the ultrasound. About 1 ounce of amniotic fluid is withdrawn. The fluid is sent to the lab for analysis, the procedure usually takes 20 to 30 minutes and is done on an outpatient basis. All right, that means the patient can come for the procedure, still go back home. So risks and consideration is usually generally safe. There's no miscarriage, it's generally safe, I beg. All right, so sometimes if they don't do it properly, the amniotic fluid can leak. Infections can come in because you are opening the woman partially. If needle injury, then rescue sensitization. Sometimes the mother and the baby have different blood group because of the dad. So because you now come and do that thing, you might touch the baby small, and the mother's immune system can start fighting the baby. So that's just it.